Hair loss can be very anxiety-provoking for patients. It's something that everyone sees. It also has a lot to do with how a person feels about themselves and how they look. And so for that reason, it can be very emotional for a patient when they learn that their chemotherapy drug is likely going to cause them to lose their hair. In terms of hair loss, not all chemotherapy is likely to give you hair loss. Some chemotherapies have a high likelihood to do so, and some have a very small chance of giving hair loss. Some chemotherapies can cause hair loss by affecting the hair follicles and affecting the way their hair grows, and so it's not able to grow properly and then falls out. There's also a dependence on the dose of the chemotherapy, whether it's given all at once or whether it's broken up into smaller doses more frequently, and also the drug itself. So some drugs are more likely to cause hair loss than others. For the chemotherapy types that cause hair loss, it's generally reversible, meaning once the chemotherapy is all done, the hair will start to grow back. That could take several months to happen, and it may not grow back exactly as it was before, but it does grow back in the vast majority of cases. There are options for patients that are very concerned about losing their hair, one of which is a cooling cap, which has mostly been studied in breast cancer patients who are receiving chemotherapy that's likely to cause hair loss. This can help decrease the amount of chemotherapy going to the scalp and may decrease the chances of a person losing most of their hair. For patients, it's important to know that the hair loss is not a permanent thing, that there are a lot of options available to help them deal with that hair loss while they're going through chemotherapy and then also afterwards, and that there's a lot of support for them in the community, in the medical field, for helping deal with this issue.